All right, guys, we've teed up our new order form and we're about ready to take our first scan. So when you hop into the software, you'll go to the next step, which is scan. And when you get into this, you're going to have this little graphic in the top left. That's going to teach you the proper scan path that they want you to go about. So what they want you to do is they want you to start in the posterior region. They want you to move anteriorly on the occlusal surface. You're going to drop the scan lingually and move back to the posterior region. And then on the buccal side, you're going to come anteriorly again. And we'll show you exactly how that works. You want to do the top arch first, the lower arch second, and then the bite last. If you look at our scanner, we're going to do the scan on a model just so that we don't have to use a live individual here. But when you pick up your scanner from the cradle, it's immediately going to want to start scanning. You can see that you have a red box on your screen and you have a blue light on your scanner. What that means is you're not capturing any relevant data. The scanner is trained to pick up tissue. It's trained to pick up teeth. It's not going to pick up, a water bottle or a coffee mug. If I wanted to scan the coffee mug, it'll recognize it. It'll pick it up a little bit, but it's not really anything that the scanner is going to want to pick up. So what you have here is a device that wants to get dentition. It's active when you pick it up from the cradle. I find that it's best to deactivate it. So when I pick up the scanner from the cradle, the first thing I do is I press the only button on the scanner. When I press that button, the red box that was on my screen goes away and my scanner has a green light on it. I'll then take my scanner and I'll put it in the proper position to start capturing data. I'll press this button again, which is a start-stop button, so it'll start capturing data again because right now it's in the stop mode. And the second I start capturing data, you're going to see a green box appear on this screen. This light is going to remain green and you'll actually hear a clicking noise. Whenever this light turns blue, this box on the screen turns red, or the clicking noise stops, it means you're no longer capturing data and you need to return to a location where you had previously captured an image. Once you return to that location, the scanner will self-orient itself and it will begin capturing additional images. You have to think of this like a building block. So every image is capturing another image and it's building on top of each other to create the 3D rendering of your patient's dental anatomy. So let's start by taking the scan. So we're doing the upper arch first. We're starting in the posterior region. You aren't hearing the clicking on the laptop because I'm recording right now. The natural setting when you receive your scanner will be to hear the clicking noise, but you can see as I move my way posteriorly, you can see on the screen that we're capturing data. Now I'm going to come back on the buccal side. Continue to capture as much data as possible. We're just going to do a quadrant for time's sake. So I'll get everything I can there. Come back, you can see some spots are in purple, some spots are white. Those are spots that we've missed. Really important that we get all the data required, especially around the tooth that we're restoring. So once we're done with this, I'm intentionally going to stop with it incomplete. I'll press the button to stop and you'll be able to see the scan on the screen. Now, anywhere where I didn't capture enough data will be very clearly highlighted in green. So that's saying insufficient data And what's really important, as you can see on our margin line, I have insufficient data there. So something like this isn't really going to affect the dental lab's ability to create a beautiful restoration for you, because it isn't on the occlusal surface and it's not really around the tooth in question. But something like this that's right on that margin line is data that we're going to want to make sure we clearly capture. So what I do is I like to rotate just to see any spots that I missed. First thing I'm going to do is I'm going to go and try to get this piece of data. So what I'll do is I'll pick up my scanner and I'll orient myself with that restoration. I'll say, okay, this is the area in the mouth that I missed the data. So I'll pick up my scanner, I'll pause it because I don't want it to disorient myself. I'll load my scanner right over the place where I think data that's most critical is missing. I'll press start again, and you'll see that that white space is now being filled in pretty clearly. And now that we have that, I remember I saw some stuff up here that I'm going to want to capture. And that should produce a pretty solid upper arch. So again, we'll review the upper arch. Sure, I'm missing some anatomy there, but it's not that relevant. What's really relevant is the area we're restoring, and that looks really clean. So I'm going to go to the next step. The next step in the process is going to be to do the lower arch. So I'll pick up my lower arch, or you get ready to do this in the patient's mouth. Again, pick up the scanner. It's going to start capturing immediately. I like to pause it, put it back in the patient's mouth, start on the posterior occlusal surface, and begin capturing data, moving anteriorly. Right, sometimes you miss a lot, so I just go back on the occlusal surface just to double check. Now I'll come back lingually, capture all the relevant stuff there. Really important that the occlusal surface is 100% data captured. We want to make sure that the bite is going to be natural. So, I've completed that. I'm going to pause this, put my scanner down. I'll do a quick view here, see if we missed anything. It looks like the tooth that's opposing the one that we're restoring is really well captured. So, maybe I'll go back and I'll get that little green spot. Pick up my scanner, starts capturing. I'm going to pause it, put it in the location where we're missing data, and start capturing that data. So now we have our upper and our lower jaw fully captured, and we're going to press finish, and we'll move over to get the bite. I really like the way that the bite is captured in this software. The best way to capture the bite, it's almost a less is more philosophy. So what you want to do is you want to have your patient bite into natural occlusion or proper occlusion. You want to pull the cheek to the side on either side and position the scanner in the back. Press the start button to start capturing. And once you capture, a small number of data points, what you'll actually see on the scanning software is you'll see the two arches fly together. So if we're going to do the bite, we are going to have the patient bite down. We'll pull the cheek so that we can slide the scanner in. Remember, the scanner is going to start capturing data, so I'm going to pause that. Patient's biting. I'm going to position my scanner in the posterior portion of their mouth. You can see on the screen here is the little mini image of what the camera is picking up on. So the second I press start, what you're going to see on the screen is you're going to see the upper arch and the lower arch fly together in unison. And at that point, you know you've captured enough data for the scan. So less is more. You'll see how quickly this works. There's my upper arch, there's my lower arch, and we're done. That's all the data you need to capture to get it into occlusion. And we're only doing a quadrant, so we can just press finish here, and we're done with our scans. So the computer will take probably 15 seconds here, maybe 10. It's going to optimize the upper jaw, it's going to optimize the lower jaw, and when we're done with this phase, it's going to immediately put us in the pre-design phase. So it's saving our data. We now have our ability to look at our scan in the pre-design phase. That's how you take a scan with the Shining 3D scanner.